you so much again, and thanks so much for your time also, sirs and ma'am. Um, so, quickly on the subject, I think I have always leaned on Professor Reddy to kind of give us a better understanding of a situation on healthcare, be it epidemiology, be it studies on science. So that mic can be taken, yeah. And so just to set the ball rolling, what has been your observations on the way things were managed in the last 2 years, and what will be your priorities if you are to actually uh, put up an action plan on Indian healthcare systems?
Well, the COVID pandemic caught the whole world by surprise. Though we knew that there was a danger of zoonotic pandemics, the systems were not fully prepared either to prevent or to quickly detect and control. So I believe India's experience has not been unique in the sense that the health system felt challenged. Virtually every health system in the world felt challenged. And they are still challenged in many parts of the world, China included. However, it is the response, recognition of the fault lines in the health system, as well as the supportive social systems, that has helped us to adopt several corrective measures. And we have seen that happening in terms of a very strong emphasis on strengthening health infrastructure, strengthening digital health, and increasing investments in better surveillance systems. There are many areas in which we are now seeing our health system getting revamped. However, there are several areas we still need to invest in for greater efficiency and equity. We do need far greater emphasis on primary health care, both rural and urban, than we have had in the past. And when I say primary health care, it has to be comprehensive, it has to be continuous, it has to provide for both acute and chronic care, and it has to be efficiently connected to other levels of care. All levels of healthcare are important, secondary and tertiary as well. But primary care is the foundational element, and it needs to be connected seamlessly in a bidirectional manner to both the others. But while we are investing in infrastructure, rightly so, and in digital technologies, absolutely essential, we must recognize that unless we invest in our health workforce, a multi-layered, multi-skilled health workforce which is adequate in numbers and even has a certain amount of slack capacity when challenged with a public health emergency so that you can provide more numbers, we will have an infrastructure which will be a carriage without wheels. We will have our digital technologies which will be underperforming assets. So this is where we must emphasize the investment in an adequate health workforce alongside all the other good things that we are doing. And since this is an economic times summit, let me say, investment in health workforce is also an economic opportunity. While employment opportunities globally are decreasing in industry, even in agriculture, in service sectors, because of greater technology-dependent solutions, health will offer the best opportunity for increasing employment. And in primary care, especially for younger people and women who are wanting to get into the labor market, it's a great opportunity. And it's very clear that both for strengthening our health system as well as for giving a boost to our economic growth, investment in the health workforce is absolutely imperative. Those are my opening remarks. But I would lastly say that it's important that we utilize all the resources that we have in our society, which means the public sector, the private sector, the voluntary sector. They exist. And we have to deal with the reality of the health system as it exists. So all their resources will have to be optimally utilized to provide, as I said, efficient and equitable healthcare across the country.
Your observations, ma'am, we've seen a major bounce that hospitals got in the last 2 years, and you spoke about affordability and quality care moving in tandem. At the same time, we see a lot of anomaly. There is a probe that is happening on overcharging by hospitals to patients, and that's again a very big lapse in a way. We don't know which way it will be headed. In such a situation, how do you actually manage a hospital profitably and also fulfill the requirements of reaching care to everyone?
Good morning. And actually, after this pandemic, everybody realized that healthcare is most important thing. As you know, this is an old saying, health is wealth. But same time, there is a one problem which healthcare is facing from many years. That is there is no faith between doctor and patient. Now, everybody thinks that doctors or hospitals are making money and they are not giving them right, treatment, or they are overcharging. But I would like to say there must be some black sheep in our profession. But same time, hospitals are trying to do their best. As my hospital, Yashoda Hospital, is known for affordable quality care. Why I am talking about quality care? Because now everyone is quite aware about everything because of this Google. So when somebody is choosing a hospital, he is going for some accreditation after this NABH. So to maintain that quality, hospital need to invest money. Like we are using all the disposable and consumables items. We are trying to keep our hospital as clean, neat and clean as possible so that patients should not get any hospital acquired infection. And for all these things, money is required. But I believe that hospital should not run on a business model also, because hospital is a place where we are dealing with human life. And when somebody is coming to hospital, he is not in a happy mood, or not he is coming for some, just for fun. He is coming for his necessity, and we are there to provide them quality care. So there has to be a balance between affordability, quality care, same time some profitability also. As well as somebody who is working in a hospital as a healthcare worker, he also needs some, some motivation, some kind of, recognition from the government, why he has to choose profession as a nurse, as a doctor, as a ward boy, as a technician. Because in the pandemic time, everybody has seen at that time when no one was even touching their family members, we were there. We were there to help you. We were there to help all the patients. So definitely there is some difference between healthcare and other industries. So I think when government is defining prices, or a private hospital is defining his own rate list, he has to take care of everything. But same time, we cannot, charge anything according to our wish, especially for foreign patients. When we talk about medical value travel, as our Prime Minister is focusing more on medical value travel, it was, we were found that it was no regulation. Anybody can charge anything from any foreign patients, and which was very bad and giving a bad impression of India. So we need to regularize everything, but same time, we need, I mean to say, all healthcare industry needs some kind of support from everyone, from society and government also.
Right. Well put, ma'am. Dr. Mahajan, let me come to you on the future paradigm of healthcare. From what we see in the last 10 years, most of the products that are in the market are actually becoming so targeted, and imaging has played a big role, and you have been synonymous with the imaging revolution in India. What are your thoughts on affordable care? That will be something that will be determining our future pathway.
Thank you very much, Vikas. See, this is the era of evidence-based medicine. no one sitting here, either on the stage or off the stage, would just take medication given randomly for an ailment without knowing what actually is the disease. Now, when that happens, that is when diagnostics plays the major role in determining what is wrong. Over the years, and especially in the last 30 years, if you see both imaging as well as lab medicine and pathology have really come into their own. If we go back to our own younger days, there used to be the family physician in one colony. Everyone went there, and he would have medications which he or she would dispense. Lal dawai, neeli dawai, and we would happily have that. Now, and at times we would get well, at times, it would prolong and we may need certain other interventions. But at independence, life expectancy was around 36 years of age in this country. Today, it's around 70 years. So something has been done right. Now, when you come into diagnostics, the reason is targeted treatment, technology, which is expensive, and at times, also over these years, what has happened, the clinical field, we've followed the Western pattern where, you talk less to the patient, get more tests done because you believe in those tests. That's how the youngsters of today have been schooled. And so we've become dependent on these tests as much the doctors as also the patients. No one wants to get treated without those tests. That has increased costs. It has also improved outcomes, there's no doubt. And so it's an area where today India still provides quality healthcare at the cheapest price in the world. And I don't compare with the West. We are 20-25% cheaper than Bangladesh, Nepal, Sri Lanka, and Pakistan, our neighbors, and with better, I believe, clinical outcomes. They're trying to maintain quality, as Dr. Arora also said, and cost has been a conundrum. How do you still continue reducing costs while reinvesting in better infrastructure, better technology? And so one thing is for sure, I think everyone has to realize that quality comes at a certain cost. And even though we are the cheapest, we need to lower it further because of affordability in our country, which is still not there. And the government is trying to make its own, attempts at ensuring those below the poverty line or those below a certain socio-economic strata. But there again, somehow, at times, the pricing is such that impacts your bottom line. And if the bottom line were to become negative because of more and more patients from that scheme coming into a hospital, then number one, quality per se will go down. Number two, you cannot upgrade technology. And so it's a conundrum I think we are facing right now, where probably digitization may be the way we will be able to go forward. Maybe telehealth, telemedicine, home health. These are all sectors which actually the pandemic has helped us leapfrog in, maybe cut down the time by 5 to 7 years. So diagnostics is here to stay. Correct diagnosis may be expensive, but if you look at cost versus benefit, unnecessary treatments, more targeted treatment. Also, I think what the pandemic has done is brought focus on preventive medicine and predictive medicine as much as treatments. So wellness as a concept, I think, is gaining weight. Even in the budget of last year and last year, the government is now bringing hygiene, water, all of these things under the ambit of healthcare, which may not be just to show that more is being spent, but rather to bring these all factors together. And early diagnosis, picking up those at risk for diabetes, hypertension, cancer early, may eventually reduce healthcare costs. And I'll end by saying we are going through terrible pollution at this point of time. And frankly, governments, and since it's a state subject, governments do variably in clinical outcomes. And governments don't spend money in controlling pollution, which 10, 15 years later is going to be money spent many times over in actually treating those with adverse healthcare outcomes because of pollution. So we need to take a long-term view of things. Those are my initial comments.
Sure.
Thank you.
Extremely enlightening. Thank you so much for sharing those thoughts, sir. Finally, to you, Dr. Gokhale. You've been a hardcore scientist, in your world of immunology, and now you are seeing a very different dimension of the function that you are actually having right now. Being part of spearheading the DBT, which is such an important department. At many levels, it's been said that this is the century of biotechnology. India has its own problems, and it's said that India will have to have its own solutions. From your point of view, what could be done to really bring about those major changes, transformational changes to the Indian patients, to the Indian healthcare system? Most of the things that we've heard from our esteemed speakers has been about targeted therapies, about how to make predictive analysis of treatments. Do you think the Western model can apply here? What exactly will be the solutions?
Yeah, thank you very much, Vikas, for this opportunity and inviting me here and wonderful gathering here. So let me first try and reframe the context actually. From the government perspective, how you look at health. Now, health is a very amorphous technology actually. For an athlete, if he's not able to run 5 kilometers, he's may be defined as a healthy person actually. For a person who say has a predisposition for Huntington disease, but he's normal today, can we define him or her as a healthy person? Or even sociological challenges that you go to, mental problems, how do we define health? So government has to look at health from a very many perspectives of life actually. It's not just going to the doctor or going to the clinic. It's from a perspective of can society be a healthy such that it can give maximum amount of benefit and value out of it actually. And I think that's why for the government, the healthcare is a very large Pandora of box actually, which involves tremendous amount of contextual things, which only technology can bring in, can make changes to if we want to make an impact actually. And I think it's very important to understand that that's the role of Department of Biotechnology is to be able to capitalize and make sure that the foundation technologies of 21st century are in fact, India becomes a major player in it. Because we've always been peripheral players in all technological leads other than IT industry that we talk about actually. And now being a peripheral partner, you always have to depend on somebody else to actually be able to carry forward these activities. So I think this is our major role to look at. But what we should also look at is at what we have achieved actually. And something that is always important to remember, if we all get together, what we can achieve actually. For very long periods of time, it was suggested, we have done 4 million vaccination dosage every day for full year. Every day for full year. 1.3 million tests every day for 1.5 to 2 years. I mean, why? Because all stakeholders were aligned, whether they were set up hospitals or whether they were companies, researchers, whether in basic or clinical research environment, or the startups. So it's really the strength of our countries is this tremendous amount of capacity that we have built in over the years in various technological sectors and perspective, which we for once demonstrated that we can really develop and demonstrate actually. And I think that's the confidence that country has in going in future. And I think this is where transformation is occurring. And I would suggest that this is a time where we are the inflection point of how and where the future would be. And which is what our Prime Minister, Honorable Prime Minister announced from the Red Fort, it's called Amrit Kal actually. This can next decade be transformative such that the technology's adaptation as well as its conversions and its ability to evolve new within the systems can make big difference, I think. I'll stop here with these few early remarks and come back.
No, I'll have a quick follow-up question to that, sir. I mean, when you actually talk about the expanse, the breadth that biotechnology captures, so far as healthcare is concerned, you have point-of-care devices, you have some of the cutting-edge MABs. Now there is talk about CAR-T therapies. Some companies actually have started work on that in India, while China, our favorite neighbor, has hundreds of those clinical trials. Somewhere, do you think we've probably been a little slower in that race of bringing breakthrough medicines? And what would be DBT's role in that?
Well, I think there's always a time that the country matures itself. I mean, one needs to understand the technology is also dependent on social structures in your country, adaptations as well. Actually, it's very important. A very important fabric in a democratic country like India is to understand the social fabric of the system. And we are proud to be a democratic country, but we also need to understand it has its own challenges that you come up with actually. So for example, gene editing technologies, that we talk about, which are futuristic curative technologies in molecular medicine that are likely to happen. If we need to enable it, we need to be able to demonstrate it in some ways that it will become important. And that's why government has taken the step of allowing gene editing technology in agriculture practices where the trans DNA is no more part of the plant system. Because in humans, it's going to be part of you. You can't get rid of it actually. So you need to demonstrate safety at a level that is demonstratable and that is also, shows efficacy and benefit to the people of the country. And once this confidence starts to come in, we may be slow starters, but we are very good at capturing the market in very short period of time. So I think we're not that bad. We are actually on the cusp of, as I say, transition that we will have to do. And I think sometimes I really think that the silent revolutions are far more better than, taking what you call the revolutionary mechanisms of demonstrative ways of doing it. I think they all combine together. What government needs to do is to make enablement and be catalytic in its role, actually. And I think that's probably the role that we want to play. And Department of Biotechnology, for example, we never had a surveillance by mechanisms that we're doing right now. For example, if you look at COVID genome sequencing, we've done 3 lakh genome sequences of COVID strains across the country by managing about 56 various centers in the country. So we are trying to understand which is the COVID strain that is prevalent in which part of the country, how is it transmitting, where is it going, what are the changes that are occurring into it. And in fact, we're going to utilize this for various other mechanisms. For example, tuberculosis now. Department of Biotechnology is going to do genome sequence more than 25,000 genomes of mycobacterial strains such that we understand the XDR prevalence, MDR prevalence in the country, and we kind of understand our own challenges actually. And therefore, we're not necessarily worried about international partnerships or, in this world, what is increasingly looking like an uncoupled, technologically uncoupled world. We need to develop our own. And as you become stronger and bigger, I think the world starts to be with you, actually work with you in different ways. I think that's what is the real motivation, you can say, in the country presently is. Thank you.
Back to Dr. Reddy. Sir, we are increasingly hearing a lot of work happening on digital transformation. And during COVID, it really got a massive lift because, just the care that people got sitting at home. And now there is also talk about AI. And one of your recent interviews, you mentioned AI can help collate large data sets and distill them into diagnostic pattern recognition and management algorithms. Uh, some thoughts on that, on exactly, do you think that will play some kind of a disruptive role really, as we move ahead in, healthcare?
I think artificial intelligence is going to be very, very helpful in the future in order to both collate and interpret and then subsequently apply the learnings to public health as well as clinical medicine. Now, we've been discussing about personalized medicine, precision medicine. We must recognize that personalized medicine is not driven only by the genetic configuration of the person or by a particular microorganism that might be detected in that person. Those are important. I'm not even talking about non-communicable diseases like cardiovascular and diabetes, which have greater complexity. We now recognize that there is a metagenome consisting of your own genes and that of the microorganisms in your gut and body. They're interacting together to form a sort of supergenome, which is actually interacting with environmental influences. And your phenotype is not just your physique. It's being shaped by your environmental and social conditions. So in these complex interactions between what might be called the metagenome and the deep phenotype or the superphenotype, you require multiple data sets to be collated. A doctor is not able to gather all that information. We do it if we are diligent. We apply both intellect and intuition to interpret that, but still you're caught short on many things. And there is something called Bayesian analytics, where you have the pre-test probability and the test result and the post-test probability. Doctors are not usually trained in that Bayesian thinking. So this is where artificial intelligence can really bring in the data and simplify things for you. But there is a catch. The data that goes into preparing these diagnostic and management algorithms is often based on Western data, which is context dependent. Now, how you actually, this pre-test probabilities and even the nature of the test result vary considerably based on the context. The physical context of the person, the social context of the person, the disease profiles prevailing in that region. Now, you cannot automatically import diagnostic and management algorithms developed in the West into our own setting. That is where our research will have to really now generate the capacity for AI on a much larger scale in this country, gather multiple data sets from multiple sources, and bring them together into a meaningful interpretation and creation of workable algorithms. That is the challenge in terms of science in this country. AI is certainly going to be part of our future, but it cannot be embraced in an unquestioning, gullible fashion. It has to be done in a very thoughtful and painstaking manner that all research must actually undertake.
Do you think this is where digital health records will also play a role? Do you think that probably will at some stage go to these very finer and granular details of, where exactly a disease can be treated, becoming extremely, personalized care?
Well, ultimately, we will have to deal with individuals as individuals, and personalized medicine will happen. I mean, I've been a clinician. Dr. Mahajan, of course, has been also dealing with people, and other doctors have been dealing with people. So ultimately, what you actually gather as a group experience, you still have to distill it to the individual in your presence, and then manage accordingly. So the digital technologies will help both in outreach, in terms of bridging distance, of bridging competency gaps between the primary care health worker and the physician and the specialist as required, will increase affordability, will increase speed of response and recognition of any disease. All these are important. However, we must recognize that digital health is not a magic button. It comes, you have to first of all find out what is its efficiency, what is its safety, any technology. What is its clinical and health benefit? What is its economic benefit? Is it acceptable to the patient, the policymaker, and the practitioner? The multiple issues there. So the scalability. So all of this requires to be studied in order to really apply. Just to take a little question on what Dr. Mahajan and others have said about quality versus cost.
Yep.
I do not see them as mutually antagonistic. Because if you actually choose your diagnostic tests carefully and don't over-investigate patients unnecessarily or over-treat patients unnecessarily, then you can contain costs even while maintaining quality. So for me, there are 4 measures of quality. Is it beneficial? Is it safe? Is it resource optimizing, that is cost optimizing? And lastly, is it satisfying? Satisfying to the patient, the family, the community, and to the caregivers. So then, if you are able to answer that on quality, that's fine. And even for digital technologies, those apply.
All the 4 parameters
All the
are
4
so
parameters
important.
will apply.
Yeah. Interesting, very interesting. So, ma'am, you are actually running a multi-specialty hospital. You will have a very clear idea of where this digital health records system is moving. The part about AI, have you started, applying those concepts in your regular administration? Where do you see this going? Do you see these really applying to the patient? I mean, finally, we would like to see some outcomes.
Yeah, actually, healthcare is not transforming a lot. If you see from last 10 years, things are changing very fast. And this AI is also playing major role. Dr. Harsh can talk more about this because he is dealing with the equipment. But if you ask me about this digitization, it is actually all the hospitals are now online. Hardly anyone is doing manual work. We are doing everything online. We are indenting medicine and we are writing discharge summary. All our test results are online available. But same time, there is one thing which is I think all hospitals are suffering. But maybe we can resolve this very soon. That is, your senior consultant is not ready to type on the any computer. So we are providing them some help. That person is, typing on behalf of them or something like that. But definitely, when we will go through this medical health record digitized, it is going to be really helpful. Like I am sick and I am traveling sometime in Bombay. I live in Delhi, but I am in Bombay. And if health record is available online, so it will be really easy. Like Aadhaar card, you can see anywhere. You can take a print of Aadhaar card. Just like that, if your health record is available, so you can get treatment anywhere. You need not to carry all the time your prescription, your test reports. So it is very helpful, and still lots of hospital already doing this. And government already announced this thing. NABH has got a letter from the health minister or from government that they are going to implement this thing within 8 months. So it will be mandatory for all the hospitals that they have to keep their reports. And I'm telling you, when government want to do something, that has to happen. And everybody has to listen to them. And it is a good initiative. So, and not only if I will not talk about this only, you can see these days, if patient is admitted in a hospital and his consultant is somewhere else in another room or somewhere, he can get all his parameters on his mobile phone. So these things are actually progressing, and it is very helpful for both the parties, for the doctors as well as the patient. So digitization is very good, but same time I always used to say these kind of things will help healthcare a lot, but same time there has to be some human touch. Doctor has to touch the patient. That gives a different kind of emotional support to the patient, which always be there, and that has to be there. So digitization is very helpful, and all the AI is doing very good job, especially like there are lots of x-rays. They can calculate all the parameters, and they can release report. But same time doctors are always very important, and they will be. So this is my idea.
Dr. Mahajan, would like to really know about the action that's happening in imaging and AI. You are putting a lot of investments in that. So,
I think India is doing rather well, especially in AI in the field of imaging. Imaging has been digital right from the get-go. And because of that, this is, if you see globally, this is the one field where most of the work in AI is currently happening. And I think there are a lot of startups in this country who are doing very well. In fact, in 2018 October, I think everyone will be glad to know, the first paper on AI in the Lancet came from work done completely within India. So this was our group along with our collaborators from Mumbai. And AI, I think, as Dr. Reddy has also alluded, is a reality. It has been slow in its uptake because, after all, we are dealing with human lives. You need validation, you need pre-deployment testing, you need fine-tuning. Data from the West and data from India are absolutely different. It's not that you can pick up something from there and apply it directly in India and vice versa. But I can tell you, at least from Mahajan Imaging, what is happening, and within Mahajan Imaging has been incubated a startup called Carpal, Caring Analytics Platform, where the attempt is to take AI algorithms and applications from the bench to the clinic, from the developers to the hospitals and diagnostic centers. And there are hundreds of AI developers globally who are making niche applications, be it for reporting a chest X-ray or a head CT or a head MR or a knee MR. I believe that in the years to come, there will be about 150 to 200 such applications which will come into day-to-day use. The ultimate idea being that these are able to work without supervision, without a radiologist. In a sense, for many of the applications to be able to replace the radiologists. Radiologists are in short supply across the globe. And what we have attempted to do is to become the middle layer, to have an open-ended system where all these applications can be put on the platform. There are already 70 such applications available on the Carpal platform. Then the most important thing, everyone claims my application is 98, 97% accurate. But we have to really validate that. We have to test it on our own data, in our own hospital before actually deploying it. And features have been built for that. And then to be able to deploy it in an open-ended manner on the hospital information systems that currently exist, or the PACS system, radiology information systems that exist, because no one is going to change their entire digital architecture just because they want to onboard AI applications in the hospital. And that's what this platform has done. Currently, working in some of the most reputed academic institutions globally, in some of the large chains globally. I can tell you, even though a lot of development is happening in our country, the deployment here has been pretty slow. And hopefully it'll get accelerated over time. And then, as Dr. Reddy said, there is so much of data. We believe in the concept of integrated diagnostics, where right from the clinical data to lab data to pathology to microbiology to genomics data and imaging data, whether it's ultrasound, X-ray, CT, PET CT, nuclear medicine, it's a huge amount of data for a doctor sitting in an OPD to be able to look at, digest, and make sense of it. That's where also at the back end, there will be artificial intelligence which will come, which will be able to integrate all of this and give it in a, if I may use the word, digested form to this clinician who's to treat the patient and give one or two alternatives. And maybe the doctor also will have AI for treatment purposes at the back end, because going through literature and suggesting that in this and this kind of case in India, for a patient who's 50 years of age, these are the two best alternatives of treatment that you have. And then the doctor uses his own experience, his own expertise to be able to provide the treatment. So this is where personalized and precision medicine is going to happen, helped by AI at the back end. It's inevitable.
Wow. I lost track of the timer because it was so absorbing to listen to our esteemed panelists. So thank you so much, all of you, for having shared all their expert views. If I can borrow a minute and get one question from the house, if you have a question, it's a great opportunity to listen to them. I will have a lot of questions, but may have missed something that is very pertinent. So any questions from the house will be great. No? Yeah, please go ahead if you can. I can't see. Can have a mic for her.
Thank you. My name is Amrita Tupelia. I'm from Johnson & Johnson, and I head the MedTech transformation within the company. Thank you very much for your insights, I guess coming from the other side, from industry, and as we talk about the theme, which is building back better, what are maybe the few areas any of you could share where industry can play a stronger role in really helping build the health ecosystem as we go forward to avoid a calamity like we did in the pandemic?
Sure.
Thank you.
Who wants to answer that? What role does the industry have to play in reaching better health?
So, clearly, there are lots of changes that we need to make into our own systems, as all the panelists really alluded to, actually, including regulatory systems of how these will be implemented across scale. What is really important to understand how this will be enabled, and I think that's what everybody is trying to absorb. For example, right now, every aspect of our healthcare system is reactive. It has to go into a proactive mode. We only go search, the consumer goes and searches and finds hospitals and doctors when they require. I think this has to be converted into a proactive mode. Now, what kind of regulatory guidelines one needs to develop to be able to look at this data, to be able to manage these healthcare practices, to be able to get confidence in people is what everybody is debating about, actually. And I think we will all come up with wonderful solutions. That's what the thought process and ideas is. But, it's what you call, it's at a stage in transition, actually. The healthcare is a trade transition. And we all look forward to how this will emerge as a much better and a stronger world as we look into the future of the country. Thank you.
Yeah. If I may just say, I think the industry can help in the adoption of digitization, because currently we are not very digital, and maybe that gives us an opportunity in this country to be able to leapfrog. The government is very keen in this whole digitization effort, with a single unique health identity, which would be digital, transportable. And that's where, if right from the lowest level at the primary health center level, all the way to the tertiary, in the entire healthcare pathway, if digital systems can be developed which are fit for this country, for us to fulfill our needs, I think that would be a big service by the industry.
I would like to say that all of you are also can take care of yourself and always go for preventive health checkup. So, prevention is always better than cure. So, everybody needs to take a call that it's high time, because after Corona, you can see healthcare is doing very well and we are always there to help you. But same time, everybody needs to help their own self. So, kindly do that. This is my message to all of you. Thank you very much.
Sir, you'd like to add?
No, as far as the industry is concerned, continue innovation, but ensure that it is accessible and affordable to everybody. That is the critical element of universal health coverage. And coming to the role it can play in strengthening digital health services, I would say training is going to be a very important component. Unless our people in the health workforce at various levels are well trained in appropriately utilizing these digital health technologies, they'll still not yield the promised benefit. So investing in health workforce capacity building, including for digital applications, is going to be an area that industry should look at.
Thank you so much. In fact, on universal healthcare, sir, I think I heard you maybe about more than 10, 12, 15 years ago, even before it became a big word here, universal health coverage in one of the OPPI conferences. I think you had made that presentation, right? So, all right. Thank you so much for being so patient in listening, and I hope it's giving you all something to really think about and help our entire healthcare ecosystem in this country become better. Thank you so much again.